Today we are in conversation with Dr. Vijay Ramanan, the most reputed doctor in India, a leading hematologist, clinical hematologist, and a leading bone marrow transplant physician. He has performed more than 350 to 400 bone marrow transplants. Dr. Vijay Ramanan also works on other blood disorders such as leukemia and lymphoma. Today we're going to talk about these blood disorders, and we're primarily going to focus on thalassemia, the dreaded thalassemia, its symptoms, its causes, and its treatment. Dr. Vijay Ramanan has also been showcased in very many magazines and newspapers, such as Forbes, Sickle, Pune Mirror, and The Times. In 2011, he conducted a very rare transplant called the
haploid denticule transplant.
Haploid denticule transplant. That is very difficult for me to actually pronounce, and I had to look at him for that. Haploid denticule transplant. And in 2010, if I'm not mistaken, he also
We did a bone marrow harvest from a 7-month-old child.
Absolutely, and that has become a world record now. Dr. Vijay Ramanan, what is thalassemia and what are its symptoms?
Thalassemia is basically a word which means thalas means Black Sea. So this is a anemia which was around the Black Sea. So the gene has come from Black Sea to us as our invaders invaded us through the historic times. And the main symptom of this is people have lower hemoglobin. Men have lowish hemoglobin. Women have much lower hemoglobins throughout their life. The basic problem is our hemoglobin has two parts. One is called heme and the other part is called globin.
Okay.
So the heme comes from iron. So there are many people who start taking a lot of iron tablets, a lot of iron-rich food when they have low hemoglobin. But if the heme is low, this iron will work.
Okay.
If the heme is normal and your globin is low, globin is thalassemia. You get this protein from genes which you derive from your parents.
Okay.
So both your parents give you one gene. So minor would probably have one of the parents giving normal gene and other parent giving slightly less functional gene.
Okay.
For example, I am a minor.
All right.
So my father gave me a gene where my hemoglobin is supposed to be manufactured less. So my globin is manufactured less.
Okay.
So I manufacture probably 5.5-6 grams of globin, and the rest, that globin binds to heme, the same amount. So I maintain around 10.8 to 11 grams of hemoglobin.
All right.
That may be considered low for a male, but that's normal for me.
All right.
Similarly, my daughter is also a minor.
Okay.
So she's got gene from me and got a normal gene from my wife.
Okay.
So she maintains around 9 to 10.
All right.
So that's that. I mean, we get that gene. It's a genetic disorder. It comes from our parents. It's very, very important for us. It's not written on our face that we are minor or not. So we need to test for it before we get married, or at least before we plan to have kids, even if you don't get married.
So what is the test that you undergo, and how do you determine that you've got thalassemia? As you said, it's anemia, and it can be mistaken for you suffering from anemia.
Yes.
So how do you determine that it is thalassemia?
So simple test is to do something called a complete blood count, or hemogram, because people end up doing only the hemoglobin. That's not good. So in a complete blood count or CBC, you get your parameters of the RBCs, like it's called the mean corpuscular volume and all those numbers. And from those numbers, at least a hematologist can find out whether there's a minor or not. So second test to be done is called HB electrophoresis or hemoglobin electrophoresis,
Okay.
in which we look for a type of hemoglobin called A2.
All right.
A is adult, A2 is when we are kids. So if the A2 value is more than 3.5%, you're most likely to be a minor. So my A2 value is more than 5.7%. So I am a minor. So that way, I mean, so many times what happens is you may be having a relative who is thalassemia major you don't know about because the parents don't want to tell you. But that's what we need to find out. For statistics thing, Marathas, for example, have 13 to 14% incidence of thalassemia minor genes.
That's huge, yeah.
Yeah. So when they get married, they look at all the things except the hemoglobin.
Except that, yes.
So it's very important to understand we need to do the test because that's more important. because every year around 20,000 kids are getting born with thalassemia major, and that child will need blood transfusion for life. Now, the definition of life is different for all of us.
Yes.
Our life may be 70, 80. Their life is around 20, 30. But in those 20, 30 years, the child suffers, the family suffers because they lose many things in the whole go.
All right.
It's better to prevent the birth of a child rather
than to go through all of this.
just try to
Right.
cure child.
Cure, yes. So you said cure. There are multiple questions running through the mind right now. But primarily, I'm going to ask you this question because you said cure. Does thalassemia have a cure?
Thalassemia basically has either you can control it or cure it. So there are two methods to controlling it. We have been using transfusions to control it for last 50, 60, 70 years. For the last 15 years, I've been using a therapy with wheat germ,
Yes.
and various other medicines to get them manufacture the childhood hemoglobin. So that's called fetal hemoglobin induction. But there are tablets which we give, and we get them to manufacture their own blood. So that's control. Cure is only by two methods. One is transplant, which is bone marrow or stem cell transplant. Second is gene therapy. Unfortunately, gene therapy is not available in India, and it's prohibitively expensive. One of our patients is going for gene therapy, and it is going to cost him something like $4 million, a single patient.
Oh my God. So again, coming back to all of these therapies, you pioneered wheat germ therapy and some novel therapies for thalassemia. So are these the alternatives that are more affordable?
So the thing is, I used it, but the wheat germ was initially used in PGI Chandigarh.
Okay.
So there was a doctor there who came up with a paper saying that it works, and that's why I picked it up from there. I added a few other treatments from other papers. There was a Mexican paper where they were using a drug called thalidomide. And so we conjured a treatment for some of our patients who had undergone transplant but failed the transplant. So these poor kids underwent through that whole severe therapy of transplant but failed. There were 13 of them in my center. I wanted them to get out of transfusions because they were taking transfusion, got a transplant, failed the transplant, they were taking transfusion again. So I just wanted them to be off the transfusion.
Yeah.
So that's why I went in search of a therapy, and that's how we found it out. It was 2008-9.
Okay.
Found out.
The wheat germ therapy.
Wheat germ therapy with all the drugs. There is glutathione. There are many other drugs,
Okay.
antioxidants, and all those things. So that therapy has been working well, and we have been treating around 4,000 patients a year on that.
Brilliant.
Total of more than 15,000 children are off transfusion. So to put that into perspective, the whole of India has done only 3,300 transplants in 37 years. 3,000 transplants in 37 years, and we have treated more than 15,000 in 15 years. So we can probably go much higher because the total number of thalassemia major, when these are the severe affected children, is around 3 to 4 lakhs. So
every year?
No, every week we are adding 20,000.
Okay.
20,000, but total is around 3 to 4 lakhs.
So are you saying that the number of patients suffering from thalassemia, as you're curing them, you also have a large number that are increasing?
Every year, yes. Because of lack of awareness that we could probably prevent it by doing a simple test just prior to marriage or after marriage, before the birth of a child.
So you mentioned earlier also about marriage and people not wanting to know. So you're saying that there is a stigma attached to thalassemia?
Yes, absolutely. So when Mr. Modi was the chief minister of Gujarat, so he did a noble act of doing the tests free of cost on all the school-going children. But none of them came back to collect the result. The main thing was, if somebody found out they are minor and they put it into the matrimonial site, if it was a boy who was minor, the girl would think, why should I get married to him? I can get a normal guy. So they will try to avoid a thalassemia minor like me.
Yes.
If I was in that list, probably I wouldn't have got married.
Yeah, because it's a genetic disorder.
Genetic disorder, and the lady starts thinking, it's not wrong. It's a bit selfish, but it's not wrong.
No, but then there's also this, I read somewhere, was it you who told me a long time ago that in marriage or when you're going for a proposal or whatever, they think that it is a lady who transfers the gene to the child.
Correct. That's a common understanding in the villages. We have seen many of these kids getting born and the father just abandoning the family and going and marrying another lady.
Okay. He's the carrier.
Yeah, he's the carrier. And Abhishek Bachchan, I think, had a thing. It's called Aadi Wali Zindagi or something like that.
Okay.
So men also transmit as much as women do. And just because a gentleman marries somebody else, he's not going to, I mean, it's a random event. So
Yeah.
so it happens usually in the lower strata, economic strata, where probably people do not have bondages. So I mean, they don't
Yeah, I understand.
emotionally bound
Yeah.
too much. So we've seen that a lot in rural Maharashtra. So we've seen at least 10, 12 families where the parents have abandoned. I have one girl whose mother also abandoned the child. So the grandparents,
When you say abandon, you mean just leave them on the streets?
they
Or
leave
put
them
them
with
in
the next or the relative and run away.
Oh my good Lord. Okay.
So I have one bad, I mean, not so good incident where it was in KM. So I got a reference for the child with anemia, and I went to see that lady with the child. So mother just asked me, so is this like the previous one? So I was meeting this lady for the first time, and she was 18-year-old, 18, 19-year-old. So I said, what happened? What happened to the previous children? So she said, no, I had 3 of them who could not generate blood. So I said, what did you do to them? Not transfuse. So I said, what happened? They died. So
It was as casual as that.
yes, and the husband of that lady left that lady, and the lady also left the 4th child also, girl child, probably died.
So tell me, we are what, 120 crore
125 crore population. Yes.
population.
Yeah.
In that, what is the percentage of people who are suffering from thalassemia?
It's very small. See, 3 to 4 lakhs is nothing in front of, I mean, probably 0.1%,
Okay.
maybe less than that.
Okay.
12 crores, 12 lakhs, 1 lakh, 0.01%.
And most of them need blood transfusions or bone transplant.
Yeah, they need blood transfusion. So India must be spending around close to 3 lakh
my
bags,
question. That
3
was my
3 lakh
question.
bags per month. So blood bags per month.
How does, a hospital manage all of this?
See,
I mean, there are times people who don't want to donate. Sorry to have
To donate.
interrupted. Yes, they don't want to donate.
yes, that's very
So-
common. So we are lucky that government of India has rules where these kids get free transfusion. So we run a daycare with the Red Cross. Our NGO does that, and we are catering to around 130 odd children,
Okay.
transfusing them every month.
Uh-huh.
So even, I mean, for a small center like ours, the budgets shoot up.
They shoot up.
Yes. So luckily, because government has rules, so many of the blood banks give us free blood, and so we are able to cater to these.
So if the government is doing this,
Government is only making rules.
It's only making rules. Okay.
They're not helping the blood bank.
Okay, I'm sorry laughing at this, but the way you said it, they're not. What about the finances? You said it's very expensive.
See, government has started some, like Maharashtra had this scheme just before the election, but there are many schemes going on under the disability thing.
Okay.
So these kids have a pension of around 2,000 rupees a month. So they get
Okay.
24,000 a year.
A year.
Yeah, but many people are not aware and they don't know where to go to take it. Central government also has a pension, which people in Maharashtra are not able to access. So if people are able to access those 2 pensions, probably they'll get 5,000-6,000 a month, or 5,000 a month.
And would that be able to help them a little
Yeah,
bit
at
in the
least
transfusion?
with the transfusion or with our therapy, the novel therapy or the innovative therapy that I have, they will need 50,000-60,000 rupees a year to be off transfusion.
Okay. The novel therapy. What is it all about? Is it this wheat germ therapy that you spoke about earlier?
It's we use wheat grass rather than wheat germ oil. Wheat germ oil is very difficult to get, and so wheat grass is there, and then we use other drugs which make the dysfunctional hemoglobin to start making hemoglobin.
Making hemoglobin.
So there are many drugs in it. So it's a combination drug. That's why we've given a common name as novel therapy. Been 15 years, and
It's been working well.
Yes.
All right.
16 of our kids joined MBBS last year. 6 of them went to IIT ISER. So, and 2 of them went to NFD, which is fashion designing. A few of them became lawyers. Many of them became MBAs.
So you're saying the life expectancy increases with the novel therapy?
It will, it's supposed to increase because the major reason why thalassemia children die is iron overload. And the major reason for iron overload is blood transfusion. And then there's HIV, hepatitis B, hepatitis C, all of them will increase if you transfuse them. So we are able to get out of all that by not transfusing that.
Wonderful, doctor. I mean, God bless you. I read somewhere that you have different types of thalassemia. So how do you distinguish that?
So as I said at the beginning, I am a minor, means I don't need transfusion. I may need transfusion if I meet with an accident or get a fever or something like that. So that's called thalassemia minor. Second category is thalassemia intermediate. By age of 3-4 years, they start getting transfused because the hemoglobin starts stopping.
Okay.
And thalassemia major is the one who the kid starts getting transfused by 6 months of age, 6 to 12 months of age. So that's the definition. So major is severe form of thalassemia, that your hemoglobin gene is not working at all. I mean, intermediate, your hemoglobin gene is working a little bit. And minor is working pretty good, as you can call minor as a variant of normal.
And all of these three, can they use the novel therapy that you...
The minor does not need the therapy.
Yeah.
Intermediate can use. They have a very good response, more than 98%. And major has a response rate at our center of around 90% chances of getting off transfusion.
Marvelous.
It's not 100, but it's 90.
It's but still, it's better than, I think, gene therapy, which is so expensive.
Yeah.
Yeah, and only few can afford that. If you're saying, how many millions was it?
4 million, 26 to 28 crores.
Oh my God. Oh my God. Okay. All right. And when we were in conversation last, I remember you also telling me about something called Sickle, which goes along with thalassemia. What is this?
In sickle, you're manufacturing hemoglobin, but it's defective. So nature per se wanted to save humans in areas where there was malaria.
Okay.
So usually tribal areas. So our usual RBCs are like saucer shaped. So the sickle RBCs are like sickle. So malarial parasite cannot stay inside that sickle. It doesn't get oxygen, so it dies. So nature created the defect so the humans could survive that. But ultimately, this defect seemed to be more dangerous than the malaria itself.
Okay.
So it started probably in Africa, then it moved, all the genes moved away from it. So we have sickle in our tribal areas. You go towards Nagpur and Chhattisgarh and all those regions where the sickle gene exists. Now there are around 40 to 50 lakh sickle patients in this country. So that's a bigger problem than thalassemia.
And thalassemia.
Because they don't get transfused that often, so they are not in the picture. But their life is cut short because of sickling. Because the sickles get stuck, they can get stuck in all the vital organs, your brain, your heart, in your lung, in your liver, kidney, bones. So all these organs get dysfunctional by the age of 25, 30.
And what are the main symptoms to understand that you have thalassemia?
Thalassemia, you will maintain low hemoglobin. If you're a major, your hemoglobin will start dropping by 6-7 months. Child will stop sucking milk and stop eating food.
Okay.
He'll start getting bloated up. All those things will happen in the first few years. In sickle, the usual symptom is pain, sickling crisis, because the sickle cells get stuck in the bone, in the muscle.
Pain in various parts of the body, or
severe pain in various parts.
Wherever it is stuck.
Yes. So if it's in the lung, you will get breathless. If it's in the bone, you'll get severe pain. So all these things happen with the sickler. So it initially happens probably few times a year, then ultimately moves on to, I have seen patients who have been having sickling throughout the year. So 365 days a year. So that's the worst form.
And it's excruciating pain.
It's excruciating pain, yes.
And what is the
treatment? So presently we are using our same novel therapy with a good result in bringing up the hemoglobin and reducing the amount of sickle hemoglobin. Whole strategy is to see if there is 30-40% of sickle out of 100%. So you try to, there's a hemoglobin called fetal hemoglobin, and if it's 5-10%, you just bring it to 15-20%. Sickle relatively will come down.
Oh.
So this F hemoglobin will go and sit between the two S.
Okay.
So they'll not bind to each other and not make it sickle.
All right.
And second is about the age of 16 years, we have an injection which is available now in India called Riverna, or it's called Crizanlizumab, which is also being used.
Okay.
So these are the two things which are available in India for sickle. Last curative treatment is transplant. So we are very hopeful if gene therapy comes to India through an Indian source, it's cheaper. The first disease which will be treated is sickle, because it'll save life and make them work as much as a normal person.
And the main reason for people not wanting to donate, you don't have enough donors.
For transplant.
Yes.
So that number has in fact come down. Last time we were speaking around 6-7 years back, the number of donors are less. It happens. It still happens. It depends on which part of the geography you are. If you are from Bengal, your chances of rejecting the offer is higher. If you are from the south, we are just doing a transplant now from unrelated donor from Hyderabad.
Okay.
So who donated it? So I think the numbers are increased. Awareness should increase, and we should ask all the young kids from the colleges above the age of 21 to become voluntary donors.
Voluntary donors.
And the stem cells today can be removed from the blood. You may not get a bone marrow done.
Yeah.
So that's it's like a blood donation. It's like a platelet donation. You could probably do.
They do some kind of PRP and things like that in certain areas. I don't know, for skin and for hair.
Yes.
Yeah.
So PRP, you take a smaller sample. In this procedure, you will be on the machine for 240 minutes, around 4 hours. That's the only thing.
That's the only thing. Do you think that the government should intervene here and have, classes or some kind of educational programs? Because
No,
this is quite a dreaded disorder.
I don't think we are looking at none of a young generation looks at the government anyway. So
Okay.
So they probably are actors and actresses.
You need a celebrity to come and
yes,
propagate this.
propagate and say, I have given stem cell. Then a million people will come and give it.
Okay.
If Ayushmann Khurrana does a movie on that, probably that will help it.
Maybe I should go and meet him. You'll come along with me, doctor?
Sure.
Done. We're going to plan this definitely. Why Ayushmann Khurrana?
That's just because he keeps on doing some innovative work.
Yeah, absolutely.
Or Akshay Kumar.
We will go together. Yeah, we'll see to it that, some of the celebrity comes on board, because
There have been movies on transplant and all those things, but I don't think they clicked. Even I have not gone and watched them. So.
But you're doing so much more better than, having to watch something like that. I mean, I'm not degrading or demeaning any of it, but you're healing people.
Yes. Yeah. So as I was telling you, if you want to get more donors, probably you'll have to do more reels.
We will do those reels. I'm going to tell my team to, get at it and see what to do and how.
You can do a reel with the.
I'm going to do that. You've become, I think, as you said, the 7-month-old
child, and now we did a transplant from a 21-month-old donor.
So this is also world record now.
We don't know. Yeah, we need to contact Guinness Book of World Record, which is a bigger problem. So 21-month-old child is given it through the blood. The 7-month-old child gave it to the bone marrow. So there are two different records. So hopefully they are records. They're good for them. Hopefully they get benefited in the 10th standard and the 12th standard.
I'm sure they will be. You've got healing hands, doctor. Well, there are other blood disorders that you have, worked on and attained success: leukemia and lymphoma.
Yeah.
And there is one that you bleed internally, hemophilia.
Yeah.
Could you very briefly tell us a little bit about all of this, their symptoms, and there's treatment for all of that?
In leukemia, you have leukemia comes from the Greek word where leukos means white and emia means a mass.
Okay.
So a mass of white blood cell is called leukemia. So you have 4 types in it. One is called acute myeloid leukemia, acute lymphoid leukemia, chronic myeloid leukemia, and chronic lymphocytic. There are 4 of them.
Okay.
CML or chronic myeloid leukemia has innovative treatment available. It always, last 25 years it's on tablets.
Okay.
Till the innovation of imatinib, that's the tablet's name, was made, people would live only 5 years. Today with CML, people live normal life. They have normal life, normal kids, everything. Just take popping one tablet, and there's a 30% chance they could be cured with the tablet, but 70% chance they have to live with it like a blood pressure tablet or a diabetes tablet.
So they're not weak or tired, no kind of symptoms.
They can run a marathon, they can do anything.
Nice.
My CMLs work more than normal people.
Okay.
So second is ALL, AML. Usually ALL occurs in children, AML occurs in adults. They're curable, but ALL needs a longer treatment. AML has around 6 months treatment.
Okay.
60% chance of curing the AML, 80-85% for the ALL. CLL is you don't need much treatment, you live with it. So we one of our former prime ministers had it, the CLL, for approximately 15-16 years. Whatever happened, nothing happened because of disease.
Okay.
So CLL, if it is very progressive, if it's progressing very fast, it's a young guy, then you need to do a lot of treatment. Otherwise, you can just wait
And there are tests to understand that you have
absolutely.
this.
They're called prognostic tests. You know at the beginning itself what's going to happen in the next 7-8 years. So you can do the test and
All right.
you'll find
All
out.
right. Okay.
Lymphoma, again, there was a guy called Hodgkin's.
Yes.
So there's a book called Emperor of All Maladies. So you can read the book. So Thomas Hodgkin's was a guy who found out about Hodgkin's lymphoma. In Hodgkin's lymphoma, if you have a lymph node swelling in the neck, the next swelling will come close to it. In non-Hodgkin's, the next swelling can come anywhere. So it jumps from here, it can jump thigh or anywhere.
Okay.
So that's how we differentiate between Hodgkin's and non-Hodgkin's lymphoma. Both of them are curable with chemotherapy. If you relapse on the chemotherapy, we have more newer drugs. There's a therapy called CAR T cells, cells,
Yeah.
which is available here. So CAR T cells will cure, or is a good chance of cure. And otherwise, we do transplants, autologous transplant.
Okay.
Patient own cell is taken, bigger chemotherapy is given. So that is available. So all the majority therapies, whatever is available in US is available in Ruby all now.
All right.
So we can help the patient with that. And last, hemophilia.
Yeah, hemophilia.
Hemophilia has changed the history of the world. Queen Victoria and you know of Rasputin and
Yes.
Russian whole thing.
Mm-hmm.
So Rasputin was involved by the Tsar because his son, Tsar's son, who was indirect, related to the British queen, had hemophilia, and he would have bleed in the joints,
Yeah.
and Tsar would not have much joy in managing the whole Russian kingdom. So Rasputin was the one who gave relief to the child, and that's how Rasputin went up the hierarchy, and that's why the whole population of Russia got against Tsar because he was ignoring
There's a
them.
history to everything.
Yes, so hemophilia has a big history. Yesterday was the the Indian Disability Day, and that's the day for the hemophilia.
Okay.
And hemophilia is because of lack of factors in your body, which is again is a genetic thing. Factor 8 is called hemophilia A. There's factor 9, which is called hemophilia B. There are a total of 13 factors, but these are the two common ones, 8 and 9, which are there.
Okay. Okay.
So that's called acquired. That's called inherited or genetic, the acquired hemophilia, congenital hemophilia. There are few people who develop hemophilia later, because we had recently a patient who did not have hemophilia in childhood, who developed it because of probably CLL like thing,
Okay.
leukemia like thing, and developed bleeds everywhere. So it's called acquired hemophilia. You have acquired it afterwards.
Yeah.
So there's a different treatment for it. For the first one, where you get from your parents, you have factors which are available, which are again very expensive. So, but government of India is trying a lot. So that factor is getting available at Sassoon and all those centers.
Okay.
So hemophilia again is improving, care is improving, but there's a lot of things to be done.
Yeah.
But-
So this internal bleeding, can you also bleed somewhere here in the brain, in your head?
In your brain, usual bleeding occurs in the joints.
Okay.
With the joint, dependent joint, where you're standing is knee joint. So that's the commonest one. Some people get in elbow, some people get it in shoulder. So these are the joints which keep on bleeding. So we follow a protocol RICE. It's a common protocol: rest, ice, compression, and elevation. So these 4 things are very done. So if you get injured anytime in a marathon or when you're walking, these are 4 things you need to use: rest,
Okay.
ice, compression, and elevation. Same thing is used for hemophilia, and a factor shot is given at that time.
Okay. Okay.
So in India, there was something called on demand. If you have a bleeding, you take a factor because the factor was expensive. Today, they are going to prophylactic, preventive. So we'll give once a week or once in 2 weeks, twice a week factor injection.
Yeah. Yeah.
So that you can lead a normal life.
Okay.
That's what is happening in Australia, in Canada, in UK. So hopefully that will come in India too.
Okay. And one question, food. Is that something that, people have to take care of as to what kinds of food that they can eat or not eat when they're suffering from these disorders?
We all need to look at it because our ancestors were working in the farms, so they needed carbohydrate more than anything. We today go and eat the idli, the dosa, the upma in a South Indian hotel in the morning, have a cup of coffee with a lot of sugar in it, but we are not doing the farm work. So we are taking the carb, but we are not doing the job our ancestors were doing. So the problem is all this sugar gets stored in your liver, get fatty liver. And that's why if you look at the liver transplant numbers, the highest number of transplants are not for alcoholics. They have been done for either hepatitis or for non-alcoholic fatty liver. Non-alcoholic fatty liver is because of food. So it's high time we need to understand we need to either follow the Jain principle.
Yes,
food.
yeah.
Probably twice a day, eat your dinner before the sunset.
Mm.
There must be a rule, because if you look at the circadian rhythm, there's a lot of work
Yes.
done by Sachidananda Panda, who is
Okay.
an Indian based in California, Salk Institute. So the insulin secretion, insulin is a hormone which is for pushing the sugar inside your cell, is from probably 12 to 5 o'clock. So our ancestors did not know of insulin, but they thought of
The circadian clock, the sunlight.
sunlight, because they did not have lights.
Yes.
So they had to switch off everything at 6 o'clock
Yes.
at the sunset. So they would have their food by 5:30, and probably they lived to 100.
Nature.
Nature.
We don't be de-linking ourselves from nature, I think. Yeah.
Yes, and then we are trying to enjoy food rather than
Our health and our life.
Like, yes.
Yes, yes.
So
Well, doctor.
tasty jeevan, extra tasty jeevan is very important.
It's the palate, right, that keeps calling for it.
My grandfather used to say, anything which is good to your palate is back to your health.
And to your soul.
That's the next part.
That's the next part. Well, doctor, thank you so much for giving us your valuable time. I mean, he's so busy. We are actually shooting all of this at Ruby Hall, the clinic where he's at, the center over here. And I'm really grateful to you for, giving us this precious time of yours. And I thank you, my dear audience, for having listened to us so intently and trying to understand how important health is for us. Our blood tells us a story, a narrative, and we really have to take care of that. Thank you so much.
Thank you.
Thank you, doctor.
Thank you.